Hi, I'm Mercedes Stevenson, and this is the West Block: politics, perspectives, and players. Well, welcome to 2021. Thankfully, 2020 is finally over and we can start looking ahead to what's in store for the year. So welcome to our very first show of the new year. Most of you at home will likely recognize our very first guest on the show. Not only has he been battling on the front lines against COVID-19, he has been on our TV screens almost every day of the pandemic, and he has been bringing us the latest details and information on the virus and Canada's response. Dr. Isaac Bogoch joins me now. Thank you so much for taking time for us, Doctor. I know not only are you bringing us public health messages on the screen and explaining the virus, you're also actually treating patients in hospital. How are you?
I'm doing okay. I think much like many of the other people on the front lines who are healthcare workers across various fields, I think we're all pretty tired. It's been a long haul, but I can't speak on behalf of everyone. But like everyone else, we're just rolling up our sleeves and trying to get the job done. And certainly, there's a lot of hope with vaccine programs rolling out, but clearly there's still a lot of work ahead. So it's been tough, but here we are. We're still doing it.
You treat COVID-19 patients in hospital. What is that experience like?
It's been challenging. I mean, it's to be quite honest, there's lots of different aspects to it. Clearly, it's very challenging to watch the sickest of the sick come to hospital. And while there are some wonderful stories of people surviving and recovering and going home, we all know the tremendous toll this has taken in Canada with over 13,000 deaths. And unfortunately, a lot of those deaths do occur in hospital. So that part has been challenging. I think some of the other challenges are around the virus itself. And we know that many family members aren't allowed into hospital settings to be with their family members, which also poses additional challenges. And we do everything we can to allow visits at some points in time, but that can't be all the time. And certainly we're doing our best with regards to that. So that's posed a significant challenge. On the other hand, I got to say, just from a purely medical and scientific standpoint, it's been fascinating. It's absolutely been fascinating. It's not every day that you get to see and face to face an infection that the world has never seen before. And what comes with that is new signs and symptoms. For example, smell and taste disturbances, and different manifestations of this infection. So clearly, this is an awful infection, and it's taken a tremendous toll. It is also interesting on one end of the spectrum as well to be managing this infection and seeing how it manifests and watching this unfold firsthand at a clinical level. So that part is pretty interesting as well. But clearly, this is just an awful infection. We all just want this to go away.
Well, and speaking of the virus, and as we continue to learn about it, initially we knew things like shortness of breath, difficulty breathing. Now people are talking about things that are happening much later, after those who even had mild infections, things like strokes or cardiac problems. What do we know about the long-term effects of this virus that are different than, say, a standard cold or flu, even a bad one?
Yeah, Mercedes, that's a very good point. So for starters, I think there's still, unfortunately, this misconception that this is just the flu, and we know it is not just the flu. First of all, the flu is bad in and of itself, and the flu kills anywhere from 3,000 to 3,500 Canadians per year and about 500,000 people on Earth per year. So not to take anything away from the flu, it's awful, and we should prevent that with the flu shot as best as we can. But this seriously is obviously taking a much greater toll on the planet and, of course, on Canadians. And we have seen some interesting manifestations of this that are devastating. It goes beyond just affecting the lungs. We've certainly seen skin manifestations of it, heart manifestations of it, blood clots as well. And then, of course, in people that have recovered from this infection, it's a small, but it's definitely a real component, a real cohort of individuals that have persistent symptoms after they've recovered from the acute illness. And of course, we need to learn more about what this is and how this manifests. And fortunately, there are clinics popping up that are helping patients get through that. But that's very, very challenging as well.
I want to do a bit of rapid fire on the vaccine with you, because everybody is hoping that will be the silver bullet, as you mentioned. Once you get the vaccine, do you still have to wear a mask?
Absolutely, you do. And I think we're not going to see a lifting of these public health restrictions until enough Canadians are vaccinated. We very likely will see a gradual lifting of these public health restrictions. It's just going to take a little bit of time. We know that people who have had the vaccine can still get infected, and perhaps they might even be able to transmit even if they are infected. We know that the vaccine significantly reduces your chances of getting infected with the virus.
So it gives you a better chance, not a cure-all, though. People still need to be careful. So far, the second wave of COVID-19 has been worse than the first. Do you foresee a third wave in 2021, despite the vaccine, just with the time period to get people vaccinated?
It certainly is possible, and we have to do everything we can to avoid that. And I think a lot of this will depend on two things. Number one, how fast we can get the vaccine to the greatest number of Canadians. And number two, how well we adhere to our public health restrictions. And adhering to these public health measures really involves twofold. On one side, there certainly is individual responsibility, and people can make good choices for themselves. But of course, on the other hand, this is not entirely about individual responsibility. We certainly need governments and public health units to create policy to keep us safe. So I think we can avoid a third wave if we have cooperation between the governments and public health units with creating smart policy, plus people making the right choices for the components that are under their decisions, coupled with a rapid vaccine rollout plan.
Who should and who shouldn't get the vaccine?
Quite frankly, everybody should get the vaccine when it's their turn. Everybody should get the vaccine when it's their turn. And we're just sort of figuring out whose turn it's going to be first. We know what the highest tier and the highest priority groups are, and it's going to take a little bit of time to get through that group. But afterwards, certainly there will be a next priority group identified, and those individuals should get it. There's probably very few reasons for people to not get the vaccine. I think that's a better way of putting it. And even those who weren't included in the clinical trial. So, for example, children or women who are pregnant or perhaps breastfeeding. I think that in the coming weeks, we'll probably have greater clarity that many individuals who might not have been included in the vaccine trials will also very likely be able to get the vaccine, probably with close consultation with a healthcare provider. But I still think that it will likely be available to pregnant women, women who are breastfeeding, people who have compromised immune systems, and other groups as well.
When do you think life will go back to normal? When can we go to concerts and hug our grandparents again? Will it be 2021?
Yeah, you know what? I really do believe it will be 2021. Canada's done a very good job in getting access to many different types of vaccines. And I think over the course of, well, certainly over the latter part of 2020, and I think it might continue over the early part of 2021, we're going to see some continued progress on the scientific front for these vaccines, and also Canada gaining access to these vaccines. And the more access to vaccinations we have, the fewer barriers we have to vaccinating the Canadian public, I think that just means we'll get back to what we remember in 2019 faster and faster. And I really think that maybe by the middle part of the year, when there's just a significant number of Canadians that have had access to vaccination, we'll likely start to lift some of these public health measures. And as we roll on to the latter part of the year, we'll probably start to see things like larger gatherings allowed in indoor settings, larger gatherings allowed in outdoor settings, perhaps mask mandates being lifted, perhaps softening of the border between Canada and the United States. And I think we're going to slowly start to see that trend towards normalcy as the year progresses. It's not going to be like a light switch where they just turn it on and say, okay, we're back to normal. I don't think that's going to happen at all. But we'll probably see a slow movement towards that, starting when a significant proportion of Canadians are vaccinated.
I think that hope on the horizon is welcome news to many of our viewers, certainly to me, and I know our team here. Thank you so much for coming on, Dr. Bogoch, and please take care of yourself.
My pleasure. Have a great day.